Hello there, I'm Amanda LeDuc, and with health education being so undermanaged, it has been seen time and time again that many patients aren't aware of the procedures that they are needing to get done. One of the most common procedures done is a colonoscopy. According to the CCAP survey, there is an estimated 15 million colonoscopies performed each year. However, there are so many patients out there that do not understand what a colonoscopy is. This is a proposal on how we can ease the education process of colonoscopies by using a flyer. This patient education is a very important necessity, and to ease the health literacy of colonoscopies, we are going to provide the flyers to the patients. One of the main goals is to ensure that we provide adequate culturally and linguistically appropriate services, also known as CLAS. One of the main goals for the flyer is to also make them in different languages as well as to help accommodate many different cultures. Part of making sure we can effectively follow CLAS, we should incorporate the standards in our plan for the flyer. The main reason these standards should be practiced is to ensure that different cultural communities have efficient access to the appropriate care. This is very important to offer the flyers in different languages so that we have visual aids for those patients of said culture. It would be not very beneficial if a patient who only spoke and read Spanish, for example, and we could only provide them with English flyers. It has been brought to the attention that many patients are coming in not understanding what a colonoscopy is. The plan of the handout is to educate the patient on what the procedure is and what it entails. As part of making sure all of the questions could easily be answered on this handout, a survey will be taken of the patients to see what they already know about a colonoscopy. Once the material is collected, the information will then be reviewed and processed to see what needs to be specifically placed on the flyer. There was a study done that involved 764 participants that averaged the age of 63 to access the comprehension of preparation for the colonoscopy after receiving a handout. It was shown that the average comprehension was a 3.2 out of 5. With just one study being done, it does show that handouts are beneficial. So with the focus on the handout being the information about a colonoscopy, such as the procedure, how the procedure is performed, how long the procedure would typically take, and what preparation the procedure would also look like. A colonoscopy is a procedure that is performed by a surgeon to examine the lining of the colon and the rectum. The procedure is typically done as an outpatient basis. A small, soft, bendable tube that is the width of an index finger is inserted into the anus and then advanced up the rectum and the colon. Before a colonoscopy can even be performed, though, the rectum and the colon must be completely emptied. To ensure the rectum and the colon are empty, the patient will be on clear liquids for a few days prior to the procedure. The patient will also need to consume some type of laxative or cleansing solution. The type of preparation depends on the surgeon. They will be typically given instructions from their said surgeon before the procedure. The procedure usually only lasts no longer than 60 minutes, and the patient is typically in a twilight state, placed under general sedation. The patient will be laying on their side, and that is when the scope will be inserted. Once the procedure is done, the patient will be observed for a few hours post of the procedure due to the sedation. Then they will be released to go home with a family or a friend. Patients need to go home with a family or a friend due to being under sedation and not allowed to drive themselves. This is the type of examples of information that would be provided on a handout. To accomplish having this handout made and get it out to the public in a timely manner with the whole project would generally take a month. The 1 week to gather all the information needed, 1 week to compile the handout, a week to finalize it and make sure everything is correct, and then a week at the printer. This is a very realistic goal to have the handout complete that will help so many patients better understand the colonoscopy. Everybody at some point in their life will need to have a colonoscopy done. We need to bring awareness to the health literacy of this procedure. The overview of the proposal will bring the insight needed to help with the patients better understand. Also, by making sure we accommodate all patients by following the standards of CLAS to make this possible. Health literacy is a very important and should be made easy to understand. Handouts on the topics will make this happen. Thank you.